Being a heart princess is fun.
Jaelyn is super strong, very smart, caring girl. She has lots of friends. She loves to participate in activities. She's just an amazing little girl.
She's very joyful. She's a lot of fun to be around. Sometimes she can be a little spicy.
We live in Rising City, Nebraska, a very small town west of Omaha. Me and my husband Jordan, and we have 4 wonderful children. It's busy. I went into labor with her about a week and a half early and had no problems with the delivery. She was perfectly perfect when I had her and while we were in the hospital.
So she was born, everything went great. We went home.
She really didn't sleep well that night, the next day, and I just felt like her breathing was really fast and like she was struggling.
And I remember Lindsay, she's like, hey, something's wrong. We need to go in. That was a terrible car drive.
And while we were in the ER, she really declined.
I remember like holding her and she was turning gray and she wasn't breathing.
They really struggled to get any type of IV in her. Her glucose was low. Her oxygen saturation was obviously low. We had no idea at that time what was going on.
It was scary, not knowing.
We were going to life flight then to Children's. And I think we got there about 11 p.m. Dr. Winter came out and said we were very lucky that we got her to the doctor when we did.
So her initial diagnosis was that of ventricular septal defect, which is a hole in the chambers of the lower part of the heart, or the pumping chambers, that communicates freely between them, as well as coarctation of the aorta. And as a newborn, she had a congenital narrowing to where that within that aorta that was severely limiting the amount of blood that could flow out of her heart and into her body. Without medical intervention, she would not have survived.
So we were in the NICU for 7 days. And then October 3rd, which was actually my due date with her, she had her first open heart surgery. And we were terrified. We just had this tiny little baby and not knowing anything about it or anything about the condition and not knowing what her life was going to look like in the future and if she's going to be able to do activities, if she's going to be able to keep up with her friends. Like, it was terrifying.
Every time a different nurse, a different doctor, a different anybody came up and spoke to us, I remember just how confident they were with every single thing that they said. And for me, it built my confidence that things are going to be okay.
It's nice to have the comfort and knowing who everybody is and more knowledge of her condition and what needs to be done. But sending your child into surgery is never easy.
We had to wipe her down. I remember they gave her an outfit that we had to put her in, and it to keep her warm, and it was kind of funny because it looks like a little chef hat. They're hooked up to so many different lines. There's so many different monitors going on and off.
After stabilizing her with some medications and support, we took her to the operating room. And we opened up the aorta, eliminated the narrowing, closed the hole inside the heart. And after a recovery period in the ICU, she did quite well.
I think that in total now, in her 7 short years of life, she's had 6 different procedures, interventions, 2 of those open heart surgeries, and 5 of those in the cath lab with myself.
What we do here in the Chris Heart Center, all of us working together, surgeons, interventional cardiologists, that is Dr. Curzon, in partnership to minimize the amount of intervention the child is going to need and be able to give the child a fully functional life, has allowed her to get to this point, and she's doing great.
This little girl keeps showing time and time again, her strength and her resilience. She's a great example of one of the reasons I love what I do, because I do get to see these kids sometimes from birth up through their lives and over the years, and it really gives me the chance to develop relationships with them, with their whole families. They become important to me.
I think the prognosis side is still unknown of like how many surgeries will continue to move forward. But to say of how we treat her is no different than any one of our other kids.
With her not having any activity restrictions, out of all their kindergarten class, there's one boy and one girl picked for the fitness award, and they have to test out on certain things towards the end of the school year, and she got the fitness award for her class. So that, I mean, to see everything that she went through at the beginning of August to getting that award in May is just amazing.
I think that she'll continue to need follow-up for the rest of her life, as patients like her always do. This is never done. This journey never ends for them. And that's one of the big things that we try to teach them, is that it doesn't end, but that doesn't have to define who they are.
I think the statistic of 1 in 100 was shocking to me. And that's why I think it is so important to keep funding the research, because we are blessed to have the physicians and surgeons that we have in our area. The research needed is because it's so common. It's such a common disease that we have to deal with.
There is a large and continuing growing population of patients from newborn up through adults with congenital heart disease that will benefit and need the power that comes with organizations like the American Heart Association.
My hope for Jaelyn is to just live a long, happy, healthy life. I don't think anybody can ask for anything more than that.